We're going to be doing the care plan for the third part. My name is Frank, and welcome to today too. Using the care plan, part 3. But before we go into any study, let's start with some motivation. It says, character, be a piece of the rock. Leadership is the capacity and the will to rally men and women to a common purpose, and the character which inspires confidence. Leadership is the capacity and the will to rally men and women to a common purpose, and the character which inspires confidence. That was by Bernard Montgomery. Now, we look at a scenario about one Mr. Gigi, a 51-year-old, who was admitted on the 29th October 2014 at 6:45 p.m. at the new block of the University of Cape Coast Hospital. The patient was diagnosed as having cerebrovascular accident by Dr. Mbro. Mr. Gigi has been well, although a known hypertensive who has defaulted treatment for many months with reason that he didn't want to refer to as a sick person. On admission, the patient could not talk properly, but his wife was around to answer questions and assisted wherever needed. He was assisted in bathing and maintaining good personal hygiene because of his impaired mobility. Patient was visited daily by his wife, friends, co-workers, and other relatives. They were always ready to assist where necessary. His son promised to pay the hospital bills, so payment of his bill was not much of a problem. Patient was placed on tap chlorpheniramine 4 mg twice daily for 10 days. IV hydralazine 10 mg start. Injection dexamethasone 4 mg 6 hourly for 72 hours. Injection crystalline penicillin 2 mega units 6 hourly for 48 hours. Tap encefabol 200 mg daily for 5 days. Tap diazepam 10 mg nocte for 7 days. And injection diazepam Lasix 80 mg daily for 3 days. Laboratory investigations requested were HB level estimation, blood film for malaria parasites, blood cholesterol level, creatinine in blood, BOE, and urine glucose. So let's identify some of the patient's health problems. Patient was anxious. Patient could not walk. Patient could develop bed sores. Had insomnia. Patient could not care for himself. He has slurred speech, constipation, anorexia, headache, knowledge deficit about the disease condition. So, from these problems, we can form nursing diagnosis. From these health problems, we can have a lot of nursing diagnosis. So, let's look at some nursing diagnosis that we can form from this. We can look at anxiety related to hospitalization. For being in the hospital alone, the person can be anxious. We can have impaired mobility related to hemiplegia and hemiparesis. Potential for impaired skin integrity related to immobility. We have sleep pattern disturbance related to change of environment. We have the potential for self-care deficit, that is personal hygiene, related to immobility. We could also have impaired verbal communication related to cerebral impairment. We have alteration in bowel movements related to immobility, that is constipation related to immobility. We have potential for altered nutrition, less than body requirements, related to anorexia. We can have altered body comfort or alteration in body comfort, into brackets pain, related to headache. We have knowledge deficit, that is cause, signs and symptoms management and prevention, related to new diagnosis. So, thank you. We'll look at that again the next time we meet. Have a nice day. Bye.